Hey, everybody. This is Stephanie with Telehealth Talent back with another video. This is for a position of the Emergency Department Technician, EDT. This is for Methodist Bonheur Healthcare here in Memphis, Tennessee. So let's go over what they do. If you look over to the left hand corner, you'll see like a little summary. So the EDT position, Methodist Bonheur Healthcare, it is in Memphis. It's a full-time position. The entry level is less than 2 years experience. So they'll accept you if you have even less than 2 years experience. That you can enter as an entry level position. You do have to have certifications. It was published on the 3rd, on January 3rd. So on this website, healthcarejobsnationwide.com, you can also search for more jobs. There are a lot of healthcare jobs on that site. But today we're going to be focused on the EDT position, Emergency Department Technician. If you also look, you can also share this job even if you know somebody. If you're not in the healthcare field, or if you're not, if you don't have requirements, or if you don't even have experience doing this, you can share this to different platforms if you know somebody. All right, let's get into it. So it says, if you're looking to make an impact on a meaningful scale, come join us as we embrace the power of one. We strive to be an employer of choice and establish a reputation for being a talent-rich organization where associates can grow their career caring for others. For over a century, we've served the healthcare needs of the people of Memphis and the Mid-South, responsible for attending the needs of an assigned group of patients and aiding the licensed nursing personnel and physician in the care of patients by performing various patient care activities and related non-professional services. Models appropriate behavior as exemplified in MLH mission, vision, and values. So let's go over the brief overview of this position. It says, responsible for attending the needs of an assigned group of patients and aiding the licensed nursing personnel and physician in the care of patients by performing various patient care activities and related non-professional services. Models appropriate behavior and as exemplified in MLH mission, vision, and values. Okay, what you'll be doing. Let's go over some of the description. Assist with patient care as directed by the charge or registered nurse. So you'll be reporting to a charge nurse, whoever's covering that area of the emergency department. Initiates and reassesses vital signs, including pulse oximetry, documents and reports findings to the nurse, to whoever that charge nurse is, or whoever the registered nurse is. The patient, each registered nurse has a specific number of patients, so you'll be reporting those to the nurse. Effectively, correctly positions patients for examinations and procedures and assist with transportation of patients. Ensures proper identification of patients. So you have to make sure that that ID bracelet matches that patient. Performs phlebotomy in a professional manner according to protocol and safety standards. So you do have to have that phlebotomy experience. Okay, you have to have phlebotomy skills. After successful completion of orthopedic class provided by CES, provides orthopedic services to the patient according to provider's orders, demonstrates competence in designated orthopedic skill. So examples of that would be application of splint, removal of plaster or fiberglass splints, cast as ordered. So if they have splints or cast, you have to be able to apply those or remove those according to an orthopedic physician. Performs additional job functions in timely fashion and documents in clinical care and pertinent observations on appropriate records, such as performing EKGs in accordance with policy and procedure. Okay, demonstrates and promotes professional practice of all members of the care team, completes mandatory and unit specific competency requirements, perform other job functions as assigned or requested. Okay, so there's a list of some of the things that you'll be doing. The training requirements, you have to have a technical degree or diploma in emergency med tech. So, so an EMT, you have to have a degree or diploma. An AEMT, which is advanced, it's the same, but you have to be advanced, or a paramedic. So you can be an EMT, an AEMT, or a paramedic for that. No work experience. So as long as you have those training requirements, you've been to school, for either three of those, the EMT, AMT, or paramedic, you don't have to have work experience. You can enter, as it states on the left, you can enter as in the entry level, as an entry level. So the license and certifications that are required: emergency medical personnel. So here in Tennessee, you have to be certified here in Tennessee. An AEMT. So advanced emergency medical personnel, a paramedic, emergency medical tech. So the organizations are the National Registry of EMTs. Okay, for the advanced National Registration or Registry of EMTs, exactly. So still the same organization that they will accept. You do have to have basic life support. So a BLS from the American Heart Association. Some key skills and knowledge and abilities that you need to have: successful completion orientation, able to read, write, and understand verbal or written instructions, ability to effectively communicate verbally with others, ability to maintain confidentiality at all times. So, according to a policy and procedures of HIPAA requirements. So you can't go around talking about this patient, that patient, because that's a HIPAA violation. Demonstrates compassion and patience with a deep level of concern for patients. Must be able to communicate effectively and in a positive manner with patients, family, public, and other healthcare workers. Must be able to cope with stressful situations. You'll be working in the emergency department, so you have to be able to handle stress well, including death and dying. People die in the hospital all the time, unfortunately, so you have to be able to deal with it. So you have to be able to deal with anguish relatives. They come a dime a dozen, so you have to be able to handle all of that. All of that can be stressful. So if you can't handle your stress well, this may not be the position for you. Comply with safety, emergency procedures, and nursing services, or nursing service policies. Ability to use equipment required in implementing patient care. Adhere to the Methodist Healthcare System Code of Conduct. So, supervision provided. There is no supervision or lead responsibilities assigned to this position. So let's talk about the physical demands. So physical activities of this position may include climbing, pushing, standing, hearing, walking, reaching, grasping, kneeling, stooping, and repetitive motion. So you got to be able to do all of that for 10, 12 hours a day, because the emergency department it's like a hustle and bustle. So you're going to be going, going, going. You may have downtime some days, but depending on the season or what's going on, the emergency department is fast paced. And if you like fast paced, this is for you. Must have good balance and coordination. The physical requirements of this position are medium work, exerting up to 50 pounds of force occasionally and up to 25 pounds of force frequently. The associate is required to have close visual acuity, including color depth perception and field of vision, to perform an activity such as assessing patients, preparing and analyzing data and figures, transcribing, viewing a computer terminal, and extensive reading. So you have to be able to chart and constantly look at a computer. You have to assess the patient, analyze the data, all of that good stuff. Frequent invasive and non-invasive invasive patient contact, exposure to patient body fluids, as well as exposure to hazardous or poisonous materials. Ability to react quickly to emergency situations. Again, you're in the emergency department. Emergencies happen sometimes, so you have to be able to have that quick response. You may have to run sometimes, so yeah, that quick response is going to help. Let's go over the education. So technical degree or diploma, AMT or AEMT, I'm sorry, and then EMT or paramedic. So those are the technical degrees or diplomas that you will need. Again, no work experience. Certifications, we'll go over that again. Advanced Emergency Medical Technician from the National Registry of Emergency Medical Technicians. That is the organization that they will accept. You have to have a BLS as well from the American Heart Association. And then lastly, boosting one of the South's greatest medical centers, Memphis blends a friendly community, a thriving and growing downtown, and a low cost of living. We see each day as a new opportunity to make a difference in the lives of the people in our community. So again, this is the emergency department technician. It's in the emergency department, so it's going to be fast paced. If you love fast paced and you do have experience or no work experience, you can pretty much come out of school and start this job pretty much. And Methodist is they're pretty good about hiring people with no experience. So if you are just coming out of school with one of these three degrees or diplomas, EMT, AEMT, or paramedic, you're just coming out of school and you're looking for a job and you do have that BLS from American Heart Association, I would say go ahead and apply at Methodist. I've worked for Methodist PRN and I've seen people that they have hired, and they do a pretty good job, even with no experience. You do have to start somewhere. You do have to learn. But this is the emergency department technician, Methodist Bonheur Healthcare. So this was published on the 3rd of January, 2026. So you still have time. I will put the link in the comment section or in the description box. I will have the link where you can apply for this position. And I wish you well on your job hunting journey. I appreciate you tuning in to I appreciate you tuning in tonight. And like I said, this is the emergency department technician, and the hiring organization is Methodist Bonheur Healthcare. Go ahead and apply. Like I said, it was published on the 3rd of January, 2026. It's a full-time position. It's right here in Memphis, Tennessee. You can have less than 2 years experience. As a matter of fact, you don't have to have any experience, as it's stated in this. There it says right there, no prior work experience. So I wish you well, like I said before, on your job hunting journey. Thank you for tuning in. This is Stephanie with Telehealth Talent. Come back for more jobs. And I appreciate you tuning in. See you next time.